Scabies is one of the most common skin infections after head lice. It is a historical and well-known disease because it causes severe itching, which becomes worse at night. People often scratch their skin until it bleeds. This constant itching can lead to anxiety and sleep problems, and in many cases, even depression. Scabies spreads most often among children and people living in crowded or low socioeconomic conditions. That's why we will talk about what scabies is, how it spreads, how it is diagnosed, and how it is treated. Scabies is caused by a parasitic mite called Sarcoptes scabiei var hominis. It is very small and not visible to the naked eye, only under a microscope. This mite can survive only on human skin because it needs human warmth and skin proteins to live. Outside the body, for example, on clothes, bedding, or furniture, it usually dies within 24 to 36 hours and sometimes even within a few hours, especially in warm or dry environments. On the skin, the female mite moves slowly and burrows into the upper layer of the skin, creating microscopic tunnels. Inside these tunnels, she lays around 2 to 3 eggs per day. After a few days, larvae hatch from the eggs, and in about 10 to 14 days, they grow into adult mites, which then continue the cycle, laying more eggs and spreading further. At first, the body does not feel the presence of the mite in the skin. This stage is called the silent or incubation period. It usually lasts from 2 to 6 weeks. It is deceptive because during this time, the person can spread the parasite, and by the time the symptoms appear, others are already infected. Over time, the immune system learns to recognize the foreign parasite, its eggs and feces, and a strong allergic-like reaction begins. The first and most important symptom is intense itching, which becomes worse at night. At night, the skin warms up, blood flow increases, and the mites become more active, moving within their burrows. The itching can be so severe that people scratch until their skin bleeds. This constant irritation leads to red bumps, blisters, and thin wavy lines on the skin. These lines are the burrows where the female mite lives and lays eggs. The most common locations are areas where the skin is thin and warm. Between the fingers, on the wrists, around the elbows, under the arms, on the waist, genital areas, and buttocks. In children, scabies often spreads to the face, scalp, palms, and soles, places where adults usually don't have lesions. After several days of scratching, secondary bacterial infection may develop, especially impetigo with yellow crusts, which is caused by the bacterium Staphylococcus aureus, not by the mites themselves. An important point is that in people with weak immunity, for example, the elderly or HIV patients, a severe form of scabies can develop called crusted scabies. In this form, millions of mites may be present on the body, while typical cases only around 10 mites cause the disease. Over the next few weeks, scratching spreads the mites to nearby skin areas and sometimes to family members. This is why when one person in a household or one child in a classroom starts to itch at night, soon everyone in close contact begins to itch too. That chain reaction is the hallmark of scabies outbreaks. Scabies spreads through touch, warmth, and time. It does not jump, fly, or swim. It crawls slowly from one person's skin to another and needs direct, prolonged skin-to-skin contact to survive. That's why it spreads easily in families, classrooms, dormitories, and nursing homes, where people are in close daily contact. The most common route is prolonged physical contact, such as hugging, sleeping in the same bed, nursing a child, or caring for a sick person. Even 10 to 20 minutes of skin contact can be enough for a mite to find new skin and start burrowing. A handshake or quick touch almost never spreads scabies because the mite moves slowly, about 2 centimeters per minute, and needs time to grip, crawl, and dig. In children, scabies spreads easily because they play closely, hold hands, share toys, hug, and nap side by side. That is why school outbreaks are so common. Less commonly, scabies can spread through shared clothing, towels, or bedding, especially if these were used within 24 to 48 hours by an infested person. The mites can survive off the human body for about 2 to 3 days at normal room temperature, but in warm, dry air, they die faster, often within a single day. This means normal classroom furniture, chairs, or desks are low risk because mites do not survive long on dry surfaces. The infection does not come from pets. Animals have their own species of mites which cannot reproduce on human skin. In rare cases, especially in crusted Norwegian scabies, where millions of mites live on the skin, transmission becomes much easier. In such severe cases, even brief contact or touching contaminated clothing can spread the disease because the skin sheds thick crusts filled with live mites. This is why hospitals and nursing homes must isolate patients with crusted scabies, since even minimal contact can infect others. The most reliable way to diagnose scabies is by seeing the mite, its eggs, or fecal pellets under a microscope, or by using dermoscopy, a skin magnifying tool. However, scabies can often be diagnosed clinically, even without a microscope. When a person has intense itching at night and typical burrows or papules in classical locations such as the finger webs, wrists, elbows, waist, genital area, or nipples, and a history of close contact with someone who also has itching, if any two of these three features are present, the diagnosis of scabies is very likely. Even if the visible signs are not yet clear, but the person has itching and recent contact with a known scabies case, it is considered suspected scabies and should be treated. In schools, families, and crowded places, this suspected category is very common because many people develop itching only after days or weeks. In such cases, preventive treatment of all close contacts is recommended to stop the outbreak before it spreads further. Scabies is completely curable, but only if both the person and their close contacts are treated at the same time. Because if one person is left untreated, the mites return, and the cycle begins again. The main goal of treatment is to kill the mites and their eggs, relieve the itching, and prevent reinfection. Doctors usually use topical medications or oral tablets, depending on how severe the infection is and how many people are involved. The gold standard is Permethrin 5% cream. This is the safest and most effective medicine for both adults and children over 2 months old. It works by paralyzing and killing the mites and eggs inside their burrows. The regimen is simple. Apply Permethrin 5% cream from the neck down to the soles of the feet, including under the nails, between the fingers, toes, genitals, and buttocks. In infants, the scalp, forehead, and temples are also treated, because scabies can affect those areas too. The cream should stay on for 8 to 14 hours, then washed off completely. After 7 days, the same treatment must be repeated, because some eggs may survive the first application and hatch later. In most cases, 2 applications 1 week apart are enough for full cure. For severe or widespread scabies, or during outbreaks in schools or nursing homes, doctors may prescribe Ivermectin tablets. It is especially effective for crusted scabies where creams cannot reach all the burrows. Ivermectin dose, 200 micrograms per kilogram of body weight. For example, 12 milligrams for a 60 kilograms adult. Taken once, then repeated after 7 to 14 days to kill newly hatched mites. In crusted scabies, multiple doses may be needed on days 1, 2, 8, 9, and 15. When used correctly, Ivermectin clears even severe scabies in more than 90 to 95% of patients. Even after the mites are gone, itching can persist for 2 to 4 weeks. This happens because the body still reacts to the dead mite proteins trapped in the skin. It's called the post-scabetic reaction. Use antihistamines like cetirizine or loratadine once daily for itching. Apply moisturizers or mild steroid creams like hydrocortisone 1% to calm inflammation. Avoid scratching to prevent new infections. Clean nails and keep the skin hydrated. To stop scabies from coming back, everyone in close contact must be treated at the same time, even if they have no symptoms yet, because remember, during the incubation period, people are already contagious. At home or in schools, wash all clothes, towels, and bedding used in the last 3 days before treatment in hot water and dry at high heat. Items that cannot be washed, like soft toys or pillows, should be sealed in plastic bags for at least 72 hours. With correct treatment, The prognosis of scabies is excellent. If left untreated, scabies can last for months or even years because mites continually reproduce on the skin. Constant scratching leads to skin thickening, bacterial infections, and even kidney inflammation in tropical areas.